Olá a todos. Nesse momento, nós vamos falar sobre o uso de monitoração contínua de glicose, CGM, em análogos de GLP-1 em pacientes com diabetes tipo 2. Eu tenho assim, o prazer de estar aqui com o Dr. Mark Evans, que é diretamente de Cambridge, que vai falar sobre esse assunto. Ele tem uma palestra hoje e a gente vai focar um pouquinho para dar um briefing para vocês do que ele vai falar hoje. Mark, thanks so much for being with us here. And I would like to ask you, how can you use better taking care of patients and using both GLP-1 analogs and using the CGM? What is the trick or great tips that you can give to us? And if you can, just to make sure, I will be translating you, so if you can wait a little bit and then I can translate for them. Let's talk about.
Yeah, no, it's a great question, and it's a new area for all of us, of course, and evolving very rapidly. But surprise, surprise, having real-time glucose information isn't just helpful for people with type 1 diabetes, it's helpful across a wide spectrum of people living with diabetes. And what your question hits at is some of the emerging data which suggests that actually people using GLP-1 agonist therapy, either already stable on therapy or just about to start, actually still benefit from having additional glucose information as well with CGM.
Let me just translate them. Dr. Marcos falou sobre a importância e o uso que pode ser adaptado para o uso análogo de GLP-1, começar o uso do análogo do GLP-1, sabendo o perfil de glicemia dos pacientes e associando essa terapia.
Okay. And of course, the fascinating question is how it works. I mean, it's just all of us, we see this epiphany, we stick sensors on people, and it works. But of course, the question is exactly how is it working? And for people with type 1 diabetes, clearly they're using this in real time, all of the time, looking at directions of arrows and changing things. For people with other types of diabetes, the question is, what happens? Are people actually modifying, learning about what they're eating, what they're doing, and exercise and stuff, and actually modifying their lifestyle in real time with this information?
Então, dos aspectos chamou que as pessoas com diabetes tipo 1, como é que elas podem usar o sensor, como o sensor vem mudando o olhar das pessoas e modificando tanto na forma como come, nos hábitos alimentares e no uso, por exemplo, da monitoração contínua de glicose, olhando, por exemplo, o exercício físico. E aqui abrindo um outro olhar para o uso do GLP-1. I could understood it was, we are talking about the use of CGM, GLP-1 analogs in type 1 population.
No, this is in type 2.
In type 2 population.
Diabetes, exactly.
Okay, so it's o uso do GLP-1 em pacientes com diabetes tipo 2 e o uso de monitorização contínua nessa população. And what's the result, the best result that you have?
So again, there have been a couple of papers out this year from looking at US insurance data, but again, it's spectacular. So the effects of adding CGM into a group of people already taking GLP-1 therapy and still with glucose values above targets has been spectacular.
So when you have the opportunity to have the CGM and the use of GLP-1 analog, can we avoid more hypoglycemia, or can we have better results when we have used both together? That's what you mean?
Yes, I mean, it works. And I think a lot of us think that actually a lot of that learning is, as I said, is lifestyle. It's essentially people will look, and anybody, diabetes or not, if they get the chance to wear CGM, they put a sensor on, they look in amazement at what happens with glucose values, and you learn from it. And I think actually that's probably a phenomenally useful adjunct then. So even with GLP-1 agonism and all of the dual triple agonists we've got coming down the road, still actually modifying lifestyle is a really, really important adjunct to all of that.
Ele conclui aqui dizendo que as pessoas que utilizam o CGM têm a oportunidade de modificar os hábitos de vida, melhorar o perfil dessa glicemia ao longo do dia. E se estiver usando o análogo de GLP-1, ele tem um acréscimo do benefício de poder ter um dado a mais para trabalhar no seu dia a dia. I think that was very good talk.
Great.
And thank you so much.
It's my
And
pleasure.
I'll be there to listen to you today.
Great.
Thank you.
My pleasure. Thank you.